Hi, everybody. This is Jessica Urenco. I am going to present my case presentation video role play with the assistance of Google Slides. I am a very visual person, so I thought this would be a great way to kind of present some of the background information on the role play. My subject, my client, will be an adult white male, mid 40s, married with two children, ages 13 and 15. He's a high school science teacher who is well educated, middle class, has a lot of friends within the school system, has strong community ties, and he has a 15-year-old son. This is the presenting problem, who was caught with marijuana at the school that he teaches at, that my client that I'm going to be role playing teaches at. The son was placed in alternative education setting and has mandatory outpatient rehabilitation. The theories I used, the first one was the family systems theory, because it recognizes that the issue of substance abuse in one family member is influenced by the parenting style and behaviors of the other family members. Poulin explains that this theory is about seeing members as both an interactive and interdependent system. In order to elicit the change in the adolescent, which is the goal here, the parent's behavior and relationship with their child must also be explored. The second theory that I took a look at was the attachment theory. And this distinguishes the particular roles that parents, primarily the mother, has in the influence to the child's behavior. Substance abuse disorders are directly related to an individual's ability to self-regulate. While many people may try an addictive substance, few actually become addicted, and the likelihood for abuse stems from the regulation between parental attachment and self-regulation. Self-regulation in terms of addiction is explained as one's ability to delay immediate gratification. In regards to attachment, when a child feels more secure, they are more likely to have a higher competence of self-regulation, therefore less likely to become substance addicted. The intervention that I'm going to be using is MDFT, which is multidimensional family therapy. It's a family-based treatment system for adolescent drug abuse and related behavior problem. Because, we talked about we need to look at the full family system, this intervention lends very directly to that theory. Multidimensional because it focuses on four domains: the adolescent, the parents, the interactional relationships between the family, and the extra-familial, and that's the social systems of the family. It's integrative because it uses a contextual framework to understand the developmental task of teens and their families. It falls under the psychodynamic intervention framework, so the use of self is pretty important in regards to the clinician. The therapist meets with the adolescent individually, each parent individually, the parents together, and the adolescent with each or both parents, so that the therapist is better able to understand each component of the structure. If there are other siblings in the family, that's the therapist can kind of decide whether or not it would be helpful to also include them in on this therapy. Within the context of that intervention, I will be using the 5-step method. The first is to listen, reassure, and explore concerns, kind of process whatever is going on or what's happening, the relevant event, provide relevant, specific, and targeted information to the client. In other words, maybe challenge them a little bit on their way of thinking, and provide contextual information. Number 3, explore coping responses. Number 4, discuss the social supports within the context of the family. And finally, discuss and explore further needs. Within number 5, you would create a strategic plan that the family could guide them in order to make the changes necessary to stop the substance abuse with the adolescent. And these are a list of my resources. I hope you really enjoy my role play.